Stream is starting. Okay, I think we are good. We can get started. It's kind of unfortunate we couldn't get the camera to work, so everyone's just gonna be watching me while Jen chats. But anyways, welcome to the live chat. Thanks for coming on and speaking with us, Jen.
Thank
Um,
you for having me.
yeah, I think this is gonna be a very helpful session to a lot of folks. So, what we're going to do today is chat a little bit more about some of the ACPE policies that have occurred in the last few weeks. I know, Jen, you're quite well versed in that. I am not, so we're going to ask Jen a lot of questions. But two things before we get started. The first is just for the audience that's watching, if you want to talk just a little bit about maybe your background, your education, and your current role. And then the second thing is because this is a live stream, we're going to go through some questions that I think people would be interested in learning about. And then secondly, people will probably add their own questions. So as folks and audience members ask questions, I'll bring them to your attention and we can see if we can address them. So maybe we can start with number one. If you want to give a brief introduction, Jen.
Sure. So I am a pharmacist. I graduated about 10 years ago. I worked for a few years in the outpatient setting. And actually, during that time, my favorite part of my job was working directly with students. So I used to take introductory and advanced students on rotations, and I had a lot of working interns. And so when I was a student at one point, I was very involved with the school and SGA and PLS and other organizations. So at the time, about 6 years ago, the dean had reached out to me asking if I had interest in possibly developing opportunities for students. And so I didn't really know too much more about that, but I applied and I got the job. And so I've been with my current university for a little over 6 years. And my main role is really placing clinical students locally in my state, nationally throughout the United States, and then developing an international program where we place APPE students in different parts of the world. So, yeah, it's a little bit about my background. I teach in pharmacy, usually in the business management courses and over-the-counter medications, but primarily is working on clinical placements for students.
And that's definitely no easy role. And for the audience out there, I recall we had a previous conversation about how many students you do coordinate, and it's quite a large amount, right?
Yes, so we have three different campuses. One is an accelerated program, which is separately accredited by ACPE, the PharmD accrediting body. And then there's a flagship campus, which is a 0 to 6 program roughly. And so between the three campuses, it's about 4,500 clinical placements every year that I help to coordinate. So it's a lot.
So no easy task for sure.
Yes.
Okay, so we're definitely speaking to an expert here. Um, a couple other questions, just to get a extent, because I'm curious on your perspective on kind of the magnitude of the problem here. And I don't know if we have the answers to these, and if not, it's okay. But I'm curious if you know what the percentage of APPEs that are no longer available after the pandemic started back in March for us.
Yeah, so I can say for hospital health system based rotations, that's inpatient rotations, at least from our university alone, we probably lost about 80 to 90% of those APPE placements. And so there's a good amount of community settings that still would allow students on site, but it's really the hospitals that has been hit the heaviest with displacements, along with ambulatory centers, because if it's not an essential service, if you can't offer telehealth capabilities, you might not be seeing your patients. So those were hit pretty hard too. And like I said, I help placements throughout the United States. So that's not just my local area. That is definitely a national trend that we have seen. And I know many of my other colleagues throughout different universities saw as well and currently do see.
Okay, that's quite a bit. So do you also know then what that translates into the in terms of the percentage of students that are unable to obtain a rotation, roughly?
So it depends what type, and it depends how the university is structured. If you do heavily faculty rotations only, if you're doing introductory rotations at the same time as APPE. So there's a lot of different factors. But I would say probably, speaking for my university alone, there was about 60 to 70% of our students displaced, not by choice necessarily. And so a lot of the community sites, like I said, they would still accommodate students. But there's a lot of factors that may go into play when a university decides to keep or not keep their students at any sites. So yeah,
Pretty large issue then.
absolutely.
Okay. So, just that was kind of a selfish question because I was curious about the magnitude of the issue. Now we can jump into some of the very big questions that a lot of folks may have, and we'll start off with one of the big ones. Um, Formal affiliation agreements. So I know last time we chatted, we were discussing that ACPE has removed the need for formal affiliation agreements. I'm just going to kind of keep this open-ended here, but what are your thoughts on this specifically, and what do you think is the implications of this change?
Well, I look at this as a big area for ACPE to support their students and their programs. An affiliation agreement is basically a legal document between a site and a university or college. And that's where you outline maybe liability insurance and the policies that you cover for your students. So if there is ever an egregious concern that happened at a site, like a drastic medication error that your student was part of, what kind of liability coverage are you providing on behalf of your student? Other things like indemnification. So if something were to happen, who is being held liable for a certain circumstance? And a lot of times these things are rare that occur, but it's important in the context if you are actually placing and utilizing site resources that you have these types of policies and procedures in place, and agreements in place. Another big factor is things like immunizations. We will require our students to make sure they meet state, federal site immunization requirements, and so confidentiality agreements and so on. So with ACPE removing the requirement, and this is only temporarily, eventually it will come back, is basically a way to support sites and universities and students to be able to collaborate on placements a lot quicker, because these agreements, if you think about, it's not who's involved, it's not just the preceptor and a coordinator at a university. It's legal teams that are involved. It's going back and forth with negotiations. And so if you can potentially remove all of those extra layers and focus on, all right, we need to support our students, we need to support the field of, I look at it as a big positive. Just because ACPE, our accrediting body, removed it does not mean that sites would necessarily say that's fine, you don't need it, and it doesn't mean a university would say that's fine, you don't need it. So you have to make sure both of those parties are also in agreement to support collaborations at this time.
Okay. Yeah, and I know you brought that point up last time. Just because this has been removed doesn't mean there are other requirements that might be required from the site itself. So I guess two follow-up questions on that. The first thing is, do you think that part of this policy change was to help support virtual rotations to make that placement faster? And then, oh, maybe you can just answer that one first and then.
Yeah, I think that's a big part, because a lot of the flexibility in the innovation that ACPE is highlighting right now is allowing activities that typically may be on site to now be virtually completed. And so they definitely recognize, whether it's site capacity, it's student safety, it's site safety. There's a lot of factors that are going in where they are supporting the need for pharmacists and pharmacy students to still matriculate, but also making sure that they meet competencies required.
Okay. And another question would be about crowdsourcing rotations. I know we briefly chatted about this, and I've also talked to a couple of my colleagues about this idea. But essentially, let's use an example of there's five informatics pharmacists, all from different organizations. theoretically, this waiver could potentially make it easier for all of us to crowdsource a rotation where we say one informatics rotation and we each take turns precepting like a group of students. Do you think this makes that easier, if at all possible?
So I definitely do think it does. And I think crowdsourcing is something that has been done. It might not just have been that terminology prior. So if I think about some of the clinical rotations that we use, it might be in an emergency department with hospitalists, and they work 7 on, 7 off. And so they are partnering with their other medical doctors to get feedback about the students. So even before this pandemic and currently in this pandemic, you need to have a primary preceptor to oversee the student, to provide feedback to the student, to give a midpoint and final evaluation. But you can work and collaborate with other folks to kind of give the best delivery of the rotation altogether. So I definitely think collaborating something like 5 preceptors for informatics, that would be very valuable to students. Everybody could give their own, contribute their own knowledge. And we currently are doing that with what I'd say is our virtual APPE institutional rotation with some of our faculty members. And I can talk about that in a little bit later. But it's basically sharing the resources that you feel most comfortable providing. And so it's not one person having to oversee 240 hours for a 6-week APPE rotation, but it's making sure that one person is giving feedback to the student and collecting feedback from other preceptors, but you're working together.
I mean, it's pretty good news to hear. I think there's a lot of creative solutions that can be then applied to help meet the needs of a lot of students.
Absolutely.
So now that it has been 2 weeks or so since this change, I'm kind of curious from your experience, especially in light of the conversation I had with Richard, I think last week, because formal affiliation agreements were kind of a barrier in some ways. What has been your experience with it so far now that it's waived? Has it changed anything at all for you?
So right now, it's our dean working with our legal department to see their comfort level. And if they have a comfort level, that's going to be the basis for our next direction of what we're going to do for these upcoming summer rotation blocks. And so if we still need to require an affiliation agreement, some of the things that might be a barrier, like requiring certain components on site, might be eliminated, and you just highlight that this is a virtual component, and so have different language or terminology related to that to make it an expedited process. But if they say that they are fine moving forward because it's in the best interest of the student and it's in good faith, that would be the direction that we would look at as well.
So technically, it hasn't really had an impact on you all. You haven't. It has not had an impact on you all because you're still discussing it.
Yep, so we were able to place all of our Block 8 students, so all of our class of 2020 can graduate on time and get a good experience. But going forward, we realize in the summer months, I don't think I've gotten one hospital that has said that they are no longer suspending rotations. So definitely up and coming will be a whole nother ball game for the class of 2021. So within probably the next 48 hours, I'd have a better answer of how we're moving forward with or without affiliation agreements.
Okay. Yeah, I think it'd be very interesting to see how sites are actually applying this policy change. So I don't want to belabor this topic, but I am curious because I've been trying to find documentation from ACPE that references this. I understand that this was like a letter that was sent out, but do you know if ACPE has anything public that references this policy change?
They might, I'm not sure if they publish it on their ACPE homepage, so it might be right there, but it is a letter that went to all schools of pharmacy across the United States that are accredited by them. And it was a letter to the deans of schools of pharmacy, specifically addressing some of the flexibility. And it's not just only rotations, it talks about offering virtual classrooms. So for example, if you have 200 students, you're not going to put 200 students in a lecture hall during this time. And typically you would have to have a waiver to give some kind of different form of education, but everything nationwide, pretty much in higher education, has moved to online. Same with about labs and simulation. So it's not only experiential education, but it is something that directly went to all deans across the United States. I have not looked because I saw the letter myself, but I would imagine ACPE probably may be posting that on their website. So that would be a place I would recommend to look.
Yeah, I've been trying to look. I don't know if I'm looking in the wrong place, but everywhere I've searched, it does not show up. But that's okay. I already sent them an email, so hopefully they can respond back because it would be nice to have something, publicly available so people can reference.
Yeah, that's true.
Um,
Especially sites, if they potentially would waive this requirement, being able
yes,
to actually see that it's okay by the accrediting body as well.
yes. I think if I was a site or a student, I would not feel comfortable without seeing something from ACPE. But so if if ACPE is watching, it would be great if they did something like that. But okay, we can move on to another topic here. And this one might be pretty short, but I know another discussion point that you shared with me was about the ratios of student interns to pharmacist preceptors. And it seems as though there's some loosening of restrictions on that. So I just wanted another open-ended question here is what are the implications of that change and what did ACP exactly say there?
Yeah, so ACPE has worked with the NABP, so the boards of pharmacy nationwide, and there was a lot of concerns around, okay, maybe we have a hospital or we have a preceptor who's willing to take students and happy to take students, but the state's ratio for a pharmacist to intern might be 1 to 2. Or it might be some kind of restriction. So they've actually worked with all of the boards of pharmacy. And other than one specific state, which will happen, but just it has to go through a statute. So there's more layers to be able to change and impact those decisions. They have waived that pharmacist to intern ratio. And so that is more at the discretion of the pharmacist or pharmacy manager to determine their comfort level with that. So that was a huge change and a huge thing that could potentially impact students being able to have certain opportunities that might have been a barrier before based off of ratios.
Do you have any instances of that occurring right now? Do you know of any of your students, their sites that waive this specifically?
Yep. So there's some preceptors that are taking like up to 6 students, and that's more what you call crowdsourcing. It's not just one preceptor having to give activities for 240 hours for this block, but they're actually collaborating in a group, and you're doing more of making sure that it's not just logging on to listen to a lecture, but you're actively participating through clicker questions or through simulation and different scenarios where you're actually having to contribute, and there's feedback given to every direct preceptor. So that definitely has helped. Another thing that I know some of my colleagues have expressed, there's some states that require you to have CEs or be a licensed preceptor with the actual state in order to precept students. So it's not just being a graduate for 1 year. For example, you might have, like Texas, you have to have specific CEs and requirements to be an actual preceptor. That has also been waived too. So that opens up the potential for more pharmacists to be able to help contribute to the learning of pharmacy students.
Oh wow, yeah, that sounds like a pretty large change. I'm just thinking as you were saying that if this policy change did not occur, if let's say we had a virtual rotation, um, those virtual rotations would only be limited to, let's say, 1 or 2 students. Would that be true?
Potentially, depending on, so some states, there's no ratios whatsoever. Other states do have very strict ratios. So it all depends on what state you're in, how much or how little it impacted you.
I gotcha. So this really just opened it up for the majority of states,
Yeah,
except
exactly.
one of them. Okay, cool. So we can move on to another topic here. The next change is APPE credit for paid activities. So the way I understand it, ACPE typically doesn't allow students to receive credit for paid experiences, but it looks like they loosened this up as well. Do you want to speak a little bit about that?
Sure. So nationwide, there's one school of pharmacy in particular for introductory rotations where they're actually getting paid, and it's part of their co-op program. So anytime our standards change, there's a little asterisk saying it must be unpaid besides this one school. And it's just kind of like grandfathered in because that's their basis of their whole program. Other than that, for introductory and advanced rotations, it needs to be unpaid per our accreditors. But what ACP has done during this time is said, okay, if you are a working intern, then schools need to document how they would say you could potentially opt out of those core rotations. So, for example, if a student has worked 4 years in a community setting and they have their APPE community, has the school developed a standardized checkbox or a standardized system to say, yes, we feel comfortable that you don't need to have this 6-week APPE in the community setting. Same thing with the APPEs in the institutional health system setting. We have a lot of students who work, actually, we just surveyed our students, and 60 students on my campus alone have worked in the hospital, most of them for at least 500 hours plus. And so looking at those specific students, is there a way to opt out? And it's not saying that they don't need a rotation, they just don't need that core APPE institutional rotation. And so at that point, you can flex those rotations and maybe do something more of an advanced level or a different, maybe they're doing informatics and it's a hospital-based rotation. So it gives them a different skill set. You just have to make sure you're standardized with your criteria, and that's something all schools should be aware of because we all received the letter from ACPE with this update. But that definitely has been beneficial because say you're limited in the number of those really inpatient rotations, if you can potentially remove 60 students from that requirement, as long as you feel comfortable doing so, one, it's helping place the students who can't opt out potentially, and two, it's giving those 60 students a more robust or a different type of experience that might be helpful to them.
The, and in your experience, are you finding that there is a lot of students that are choosing to opt out?
So we've actually never, ACPE has always, since standards 2016, so that was our last revised standards, they've always allowed an opt-out criteria for introductory rotations. And as far as I'm aware, there was no schools of pharmacy that had any opt-out for introductory. There was one paper published. It was talking about our previous standards, and there was 2 schools of pharmacy that allowed students to opt out and get a different experience. But when our standards revised, when the survey went out, no schools did that. So as of right now, a lot of schools, if you're familiar with AACP, which is American Association of Colleges of Pharmacy, this is a hot topic about opt-out criteria. There's task force groups being developed to see what would be the competencies that you say students must have in order to not have this core rotation. So I definitely, I can't speak on behalf of my school, but I'm pretty confident that we will be moving forward once we have our criteria defined and once we feel comfortable enough that a student meets the criteria that we would opt them out. And I can say the same thing just based off of posts through our connection board of all the schools of pharmacy. This is a big area that schools are looking at.
Okay, sounds complex enough that we'll move on to another topic. But the next topic I think is also quite difficult to discuss. So try to unpack it slowly with some of the questions I have here. The next topic is virtual core rotations, and it's one of the things that we were very interested in tackling, but we thought this would be very difficult to tackle. But my understanding in some of the discussions with you is that this might be a possibility, and this is a possibility to do virtual core rotations. But I think the details will be very important in how this is carried out. But let's start off with something very basic here. So everyone's on a baseline level for virtual core rotations. let's just say core rotations. What are the typical requirements for core rotations that ACPE has even outlined? So things like, is there a certain amount of hours that are needed, and what types of core rotations are required?
Sure. So we'll focus on APPE or advanced rotations, and our accrediting body outlines that 160 hours must be in 4 areas. And so those 4 areas are ambulatory care and community, which we call our outpatient rotations. And then the other 2, which must be 160 hours each, are institutional health system and internal medicine, which some schools will call general medicine or acute care medicine. So there's different terminologies, but that's basically those 2 are inpatient rotations. So that's the first question, and the amount of hours must be 160 minimum for each type.
Okay. And so out of the policy changes that ACPE has laid out, what exactly have they even said that would allow those core rotations to be virtual?
So they made a statement through the letters to the deans, and they outlined that 160 hours does not necessarily have to even all be contact time. So it does not have to be clock hours. It's not to say that you can have 0 time, but you do not need to have 160 hours as clock hours. And we're going to focus on APPE because IPPE might be a little bit different, but I know this is where a lot of schools and a lot of preceptors are looking at. So there's also an important factor to think about is when we are kind of having directions of what your core rotations are, they group the inpatient together and they group the outpatient together. And that's an important thing to remember when probably we talk about a few more questions down the line is when you're looking at the 160 hours for each of the types of rotations and you're looking at what the competencies are for each of the rotations, just remember that it's blended for outpatient experiences and blended for inpatient experiences.
Okay. And I would just pull, let me see if I can share my screen real quick here. Pull this over and share. What happened to the thing? Do you see ACPE?
Yes, I do.
Okay. So if you go to ACPE's website, you see this beautiful update on COVID announcement. And they made this statement here during the pandemic. Decisions to move coursework online or provide alternative supervised practice experiences, which is probably APPEs and IPPEs, are made at the discretion of the program as long as the program meets the expectations set by the accreditation standards, such and such. So it seems a little wide open. And the reason why I bring this up is how do you make sure? I'm assuming there's some documentation or compliance that's needed. How do you make sure the experiences you're providing to the students actually meet, the accreditation standards? Do you have any methods that you're using right now?
Yeah, absolutely. So one thing I can say is a lot of people probably not like this at all, but I really enjoyed being on the curriculum committee. I was on that for about 5 years, and now I co-chair of our assessment committee. So in addition to placing clinical rotations and students on clinical rotations, I really do like to know the ins and out of our pharmacy program and our standards and things like that. And so documentation is most important when you think about these types of things. And so I can kind of walk through what we did, but if you are offering activities virtually, and I can say specifically ACPE, when they came out with those dean's letters, they talked about maybe you're on an internal medicine rotation or an institution rotation, and things like that are common, maybe like a journal club or a SOAP note or a case presentation. Those don't have to be in the four walls of a hospital, so So basically, look at what you can move to a virtual platform. Use telehealth capabilities potentially if you're communicating with patients and direct patient care. But think outside the box, be innovative, but make sure you're meeting the standards. And so the most important thing is documentation and knowing what the standards are. So for core rotations this block, anything that we shifted virtually, we stuck with our faculty members. And that's because as a faculty member at a university, you should be well versed on the standards and the expectations of what you can and can't do. And so we started off with specifically core rotations with faculty, but we are looking at expanding that to certain preceptors that we know for core rotations who are what we'd say friends of the college, and they like standards and being on dean's meetings and stuff like that too, who would be good at being able to document what is needed.
And I'm kind of curious about the pragmatic way you're operationalizing that too. Are you having the students just basically write down everything they're doing? Is there like a checklist of some sorts? Like, how is that documentation occurring?
Yeah, so it's we just did a Qualtrics survey, and I actually today I finished up exactly how many students need certain direct patient care activities and how many needs public health activities for an outpatient setting. And to a T, I can tell you every single one of our students across all 3 campuses, I know what they need or don't need. And basically what it is asking students to go through. It's what we called our guidance document. So that's a document provided by ACPE for best practices or best standards in pharmacy education. So it could talk about different components with interprofessional activities or your outpatient rotations or your inpatient rotations and so on, or even your pre-APPE program. So all of your classwork and all of your APPE rotations, what kind of components should be integrated into those areas. So what we did is basically use the guidance document. And interestingly enough is that our guidance document for the inpatient criteria is verbatim the document that is made by ASHP to prepare students for a PGY1 residency. So that's what actually we had, and when I say we, I mean ACPE, our accrediting body, had adopted as the best practice for inpatient experiences. So I'm going to focus on that versus outpatient because that's probably the hardest for all of our universities and all of our students to obtain at this point. And we used that document, built it up in Qualtrics, and basically what students had to do is go through and document on every single rotation that they've had prior, what kind of experiences did they have in each of the different areas. So when you think about an inpatient rotation, there's 4 main components that ACPE highlights in our guidance document. And it's focused on health pharmacy systems, medication safety and quality, clinical applications, and then the 4th area is professional practice. And so what our students had to do is go through and document all of the applicable activities for each of their rotations. It seems beastly, but once you get that information, it's a huge Excel document, and I'm sure you're very familiar with this, but it's easy enough to break it all down and digest. And so students had to provide that through Qualtrics. We collected it in our office, but then what they also had to do is provide their survey answers to their faculty preceptor for their core rotation. And this was an important component because now the faculty preceptor can say, all right, well, I see for med safety and quality, you've done X, Y, and Z related to maybe a P&T committee. Can you give me a project? De-identify anything that's sensitive? Or can you walk me through the process of what you actually did to contribute in this area? So they're spot checking students. So it's important that I know 100% of the time students report exactly what happened across the board, but in the event that something's not reported accurately, we wanted our faculty to feel comfortable enough to say, yep, I feel that you appropriately have done enough related to clinical applications, or no, I don't, and this is what I would consider a gap in your inpatient experiences. And so they have this survey, they've talked with their student, and now basically what they're doing is they're working in groups. We have a faculty member, for example, who her whole rotation is an elective on medication safety and quality. And she's part of our institutional core rotation virtual group. And so she's the expert, and she is fielding any kind of gaps that students are needed for any of our core institutional rotation. And so I can go into the weeds a lot about that, but the biggest thing is collect what has already been done. And luckily for us, this is the last rotation students are on. So that means that they've had contact time in all of these areas prior. And so now in their APPE year, in this 8th block, it's 240 hours in length. But remember, you only need 160 hours for each core rotation. So now we have opportunities to flex 80 hours from each of the previous rotations potentially. So these are all contact times. And if you use the blended model, which is what our guidance supports for inpatient and outpatient blending, you can document that you've had the contact time prior. It might not be with this specific preceptor, but this specific preceptor is doing due diligence to check what has happened prior. They're getting the projects from students, they're having the conversations. In the last week of the rotation, we will ask all of our preceptors to say, do you feel confident that the students between the previous rotations and your gap projects that you assigned meet the competencies, yes or no? And so before we ask that question, we definitely have had conversations to say, reach out to us, reach out to the chairs, make sure that we can assist you before we get to the point of, is somebody checking no for 5 students? And so it's giving the support prior. But the reason we are able to offer virtual in this rotation is because we are flexing the contact time in a blended way, collecting what has been done. And so because it's a lot of documentation, a lot of things to read through, that's why we stuck with faculty right now. But starting block 1, there are some preceptors I feel very confident who could do this, who has sat when ACPE visits. They visit schools at least every 8 years, if not sooner. They've sat on our boards with ACPE visiting. They feel very comfortable talking about different aspects of our program. And so we will likely include some of our non-faculty preceptors as well. Did I completely confuse you?
No, I think it's very fascinating. And I have 2 follow-up questions for you.
Sure.
The first one maybe not so much a follow-up, more so just to confirm I was able to digest all that great information you had. That's one. And then I want to say these 2 things because the first one, I want to group these into students that are probably finishing their last rotation onwards to graduation. It seems like a lot of this was done to make sure students can meet the requirements before they graduate. And then the second bucket I'm really interested in getting your thoughts on is students that will be starting rotation. But let's hold off on that bucket first.
Yep.
And for the students that are graduating, if I can recap, I'll try to be brief here. The main thing, as I understand it, is that, there's a lot of students that needed to graduate. You and your team came up with a survey to assess what are the remaining gaps because, it happened in the middle of rotations. Depending on those gaps, you were able to have these virtual, preceptors or that you use it within your faculty to deliver those certain areas per ACPE content areas. So if it was med safety or clinical applications, whatever, what have you, you would be able to take those students per the survey, match them with those preceptors, get them those requirements, and of course they would make sure it's okay. They would do spot checking, make sure it's appropriate. But not only that, you still have the wiggle room and flexibility to flex those hours because you're saying your rotations were like 240 hours?
Exactly. Yep.
Okay. Is that kind of why you did all that? It's mainly for students that are graduating to meet requirements per ACPE and all that. Does that sound
Yep.
right? Okay.
Yeah. And so ACPE never waived that, they never said that you can have 0 hours of contact time. But the whole model that has been since 2016 with our standards it's been blended to outpatient experiences and inpatient experience. It's never put buckets on saying this must happen in ambulatory care, this must happen in community, this must happen in institutional health system, etc. So we use that to our benefit in basically documenting everything prior and using that as the contact time and delivering the rest virtually. And honestly, I think it's been even more robust than a lot of our rotations before, because now you are intentionally creating projects for students and intentionally creating activities specifically related with these different buckets on the forefront of your mind as you're developing the rotation. So absolutely.
Yeah, there's definitely going to be a lot of creative solutions that come out of all these policy changes. So, moving to the a second bucket now, which a lot of schools are probably going to be starting to shift to. They probably are already. So, students that will be starting rotations, and they obviously will need to complete core rotations. Would it be reasonable to say that they can do something very similar to what you have done, where if someone wants to virtually precept a core rotation, that preceptor or that organization probably should go on to ACPE, look up those four content areas, pull the activities they can do virtually, use a survey to make sure they're meeting those areas, and that should theoretically meet the requirements for ACPE as long as they do that and document.
Yep. So, well, there's a lot of information that you can read through the standards and whatnot. But if you use that, I'd say the big caveat is depending on what the university has as they might not just have ACPE standards. You could potentially have your own programmatic standards. So I mentioned like one school of pharmacy that specifically has co-op as their benchmark to, basically that's their claim to fame is using co-op programs. And so that might be a little bit different. They still have to meet all of the accreditation standards. But as long as, you can outline and you can document what meets your own programmatic standards as well. Absolutely. So.
Okay. So at minimum, they would need to meet those activities dictated by ACPE for core rotations, plus any programmatic requirements that the school has.
Yep. And I would also say any preceptor that is taking students, it is required, and it's always been required by ACPE that you do have preceptor development before you start taking students. So if you were to take students from 5 different universities, it might be a lot, but 5 different coordinators from those universities should be reaching out to you to go over preceptor development, expectation, programmatic needs, giving feedback to students. So that has always been an expectation, and that still would be an expectation going forward. So it shouldn't be a preceptor trying to kind of figure it out of how you're documenting feedback or what are the requirements or what are you grading on. That should be set up first and foremost too, to vet sites, but also to make sure the preceptor questions are answered.
Okay. There's definitely a lot of communication back and forth between the preceptors and the APPE coordinators then.
Yeah.
Okay, we have maybe, let me see here, 2 more questions on this topic and we can move to maybe some wrap-up questions. The first question should be maybe pretty simple. Is there any specific laws or regulations that preceptors should be mindful of for virtual core rotations?
Yeah, so the ratios was a big thing, which, like I said, every state besides one, which because it's a statute, there's a little bit more to go through for that. But one of the biggest things that's required is, as an intern, you need to have direct supervision. So hypothetically, if you are working with students and you're doing a virtual rotation, make sure that you are not having your intern calling patients without you supervising in some way, shape, or form. So I can tell you, one of our faculty members, ambulatory care, clearly she does telehealth, but it's a 3-way call. She's making sure if student is talking to a patient and counseling them, she is going through that conversation with them. So that one is probably the biggest thing that I would say make sure to focus on even more, because typically, say you're in a community setting, you can hear your student counseling on over-the-counter medications, you know what I mean? But if you are virtually precepting, you still need to make sure you're providing that direct supervision. So that would be the biggest thing to focus on.
Okay, so that could be a little rate limiting in terms of like taking on a lot of students then.
Yep. And so the other thing I would say with that is when you have to provide direct patient care activities, it is, if you go into the document of what they define as direct patient care, it is not all only face-to-face with your patients. That's something that a coordinator can go over with preceptors too, of what would be direct patient care activities. So ideally you want to be some kind of telehealth, communicating with your patients, but that's not the only way to deliver direct patient care and supporting your patients.
Okay. And then maybe one last question on virtual core rotations, and that would be your experience thus far. It sounds like you are doing some virtual core rotations, primarily with faculty. Have you done any without faculty so far? Yeah.
Yep, all of our electives are, well, there's some faculty members delivering virtual electives, but the non-faculty for a lot of our electives right now. So Richard, who you interviewed with last week, is taking several of our students, and I did check in, and they are loving the rotation experience so far.
Nice.
But yeah, absolutely. We figured this is completely new territory. We want to make sure we feel comfortable with the documentation and stuff. And now that we do, we would be happy to open it up more. I don't think I talked so much about the block one and the model that we're using for non-faculty members too, along with our faculty. I can talk more about that. But like I said, the virtual experience so far, feedback that I've gotten has been very overwhelmingly supportive of it, and actually having more intentionality with what's being designed and developed and supported for students. And preceptors not feeling like it's me overseeing every single student for the 240 hours, but combine your resources and make it a good experience. You're delivering experts in a lot of the different areas, which is, instead of being a jack of all trades, you're resourcing with the best folks for your type of rotation, which is nice.
Oh, it's good. It's good to hear that it's going well. It seems like a lot of the students and preceptors I've talked to have heard the same thing, so it's great to hear from your perspective. Okay, I know I've asked a lot of questions, and it's been a long time, so we can start winding down on some of these things here. So, one of my questions is kind of overarching is what do you really see, where we are right now with both the pandemic, how far we are with the virtual rotations, ACPE policies, just in light of everything, what do you really see as like maybe the top one or two barriers right now?
Yeah, I'll speak for myself, not my thoughts of my employer or anything like that. But I absolutely would say my own opinion is that hospitals are not going to be having students come back for at least the summer.
Mm.
I see universities already canceling their fall semester on site, and so they're expecting students to come back January 2021.
Wow.
So that's definitely has been at the forefront. And so initially we started going down the path of let's just wait it out, and we'll have students start rotations maybe next, block 2 or block 3, because we have 8 blocks to work with at my specifically university. But then you're just kind of pushing it down and hoping for the best. But I really don't expect the best. I expect this pandemic to eventually decrease, but we're not going to be at the level of normalcy for a very long time. I honestly don't think, at least until we have a vaccine in place, is my own personal opinion. So it's important to provide education to students, but it's also important. Initially, my thought process was hospitals keep the students, all sites keep students. But as I was seeing the low PPE, I was seeing healthcare workers not even have the appropriate protection, inpatient and outpatient. I just looked at that as a big risk to our students. And we are a large university, but we do have a lot of affiliations, a lot of collaborators. And I think we could have probably put students and, you know, saturated sites and get everybody on site for contact time. But I don't think that would have been the best approach for students. I don't think they would have gotten the attention and the needs met using that. I think honestly, using virtual is better for not inundating everybody. I think it's giving a lot more intentionality to what's being designed. And I truly think that after this pandemic, you are going to see digital health, telehealth, telemedicine skyrocket more than it ever has before. And I think this is going to be a big catalyst to make that happen sooner than later, which I look at as a silver lining, because I think that area definitely needs to grow. So, yeah.
I'm still trying to marinate on your comment there. I don't think I expected that in terms of some schools have already canceled classes for the fall, so there's a possibility that we might not have students go rotate on site, especially to hospitals, until January 2021.
Potentially. I mean, you have to, the site has to feel comfortable. Well, and this is not just pharmacy. So when I would get calls, literally there was an entire week or 2 weeks that every 30 minutes my either phone was ringing or an email or other. And it was like, so, you know, effective 1 hour, your students need to be removed from the site. And I'm like, oh my goodness. And so I have not heard one site that says, yep, you know, starting in May, we're having all of them back. So it's, in my opinion, it will be a long time before sites feel comfortable hosting students again.
Yeah, and I think my takeaway from that is, of course, we don't know what's going to happen, but based on that, it would seem as though it would be important for schools to start planning ahead for that possibility and really strengthening strategies to help meet like core rotations and make their virtual rotations stronger, if anything. Thinking about that.
Absolutely.
Okay.
But if I had my way, I would have every single one of our students do an elective in either digital health, informatics, telehealth, something like that, because they need those skills. I can't be the decision maker on everything, but I think that's so valuable for students. And I think that has definitely exponentially grown for those needs when during the pandemic and after the pandemic. But for core rotations, basically what I described for our block 8, we're doing the inverse for block 1, where it's going to be virtual core rotations, specifically for institutional. And then what we're doing is the students who are doing a virtual institutional are going with the same preceptor. This is what we're trying to design right now for contact time at a later point in the academic year. So there's a lot of shifting around of rotations, but you're giving, instead of 6 weeks of preceptor for block 1 and then a different person later on, you're giving 12 weeks to one preceptor and 6 weeks is virtual. And then eventually when students are able to go to sites, 6 will be contact time. And so that's how we're kind of like documenting what's happening virtually, and then gap projects will be done contact time at the site at a later point. And that's what I would say for any of your potential preceptors listening. If they're affiliated with the university or they want to be affiliated with the university, especially if they're an inpatient preceptor, is it possible to consider that blended model? Our accreditors already blend it. Give half your time virtually and then the other half as contact time at a later point. And that would honestly help a lot of students, help a lot of schools, help keeping our healthcare professionals moving forward. And I'm not just speaking pharmacy only, I'm talking about all of these disciplines that have been displaced, PA, nursing, pharmacy, everybody. And so if their accreditors allow it, this is a model that could potentially work for a lot of people.
Okay, and just because you said all that, it seems like your organization has done a lot of work on that. Is there any resources that you can share with the public from your institution or references that you can point them towards?
So for like the documentation purposes, or
I would say any resources that you have at all that may be beneficial.
yeah, so we have to document specifically for pharmacy the inpatient and outpatient experiences, and then the other big thing that needs to be documented is the majority of rotations in the APPE year for pharmacy students must involve direct patient care. So I have test surveys that I'm happy to share of what did that look like when we developed our Qualtrics. I have shared it with other universities. I think there's at least 5 universities right now using the same questions. And so I think there's strength in numbers, but we all have the same accreditors. We're all going through the same thing. And so I'm happy to share those test surveys
Okay.
with anybody who needs it.
Yeah, that'd be great. And then, so it would be okay if let's say, you share it and I post a link to them in the description of the video?
Yep.
Okay, cool. I think that would be very helpful for folks. Okay, another last question here is it's kind of a three-part question, but it's all the same. Is what kind of recommendations do you have for these particular groups based on what you've seen? The three groups, of course, are the three main ones: the students that are in the midst of this, the preceptors, whether they are, especially the ones that are thinking about starting it, like virtual rotations, or preceptors who are looking to scale it, and then your fellow APPE coordinators. Like what kind of recommendations or tips do you have for those three groups?
So for the students, my biggest thing would be flexible. You know, your university and your experiential department is not out to make your life miserable, but understand the limitations that are happening right now and be flexible, be appreciative of the opportunities that you can be given. That's huge. And I can say overwhelmingly, our students definitely have shown that support and appreciation, which I appreciate. So that's for the students. For the potential preceptors, if you work inpatient, can you offer a blended rotation? So start off in the summer months doing virtual rotations, but also offer the contact time at a later point when your facility allows. That would honestly be very helpful. I'm happy to kind of walk through what that looks like. And even if it's not necessarily both your internal medicine and institutional, can it be a specialty elective like cardiology or critical care and internal medicine? A lot of those specialty electives, our accreditors actually have now allowed us to shift it to meet the internal medicine requirements. But on the other side too, a lot of students are disappointed by not having two different experiences and more intense capacity because they want to do residencies and they want more of that hands-on intense inpatient activity. But if you can offer 12 weeks, half virtual, half contact, that would be very helpful. And then finally for APPE coordinators and experiential programs, use the resources on AACP. There's a lot of posts. There's a lot of people open to sharing ideas and resources. Like I said, I shared the surveys with at least 5 different universities that are using them right now, along with my entire consortium. I'm part of there's 10 schools of pharmacy in New England where I'm located. And a lot of them, I shared the resources with them as well. So utilize the other schools of pharmacy. We're all going through the same thing, some harder than others, like New York. It's a very challenging time for them. And I do appreciate, they're offering input. Same with the colleagues in Washington when that first started, and they offered kind of what did they do for their model. And it's important to share your resources. So that's what I would offer for APPE coordinators.
Okay, lots of great advice. And we've chatted quite a bit. It's been an hour now. uh, is there anything that maybe I missed that you really want to say? What do you think?
I think for me personally, selfishly, maybe, I really appreciate working with Pharmacy Informatics Academy, and I appreciate the digital health and the informatics space, and that's where I'd really like to grow our electives. Telehealth, telepharmacy, definitely. anybody who can offer ambulatory care. If you have telehealth capabilities, that has been specifically cited by ACPE to be able to meet the ambulatory care requirements. If you have students who work for your hospital or your community and they can potentially opt out, think about suggesting that to your students, who can suggest it to the coordinators, because that helps with the influx of certain rotations. And then the blended model. Really do due diligence to see what you can or cannot accommodate. What I'll specifically do is, along with those links, I'll provide the guidance document for inpatient and outpatient, because that might help when you actually see the different buckets that you have to meet in the different suggested activities. It might make more sense of, oh, well, maybe I can blend this and maybe this would work. So I'll send that as well.
Okay. That is great. Lots of great information. Uh, Thank you for coming on and sharing all of that. I definitely did not have that in my brain here. So a lot of great information. I'm excited. All of us will do our best to spread this everywhere we can so people can get a hold of it and learn from your experience here. Um, Okay, I think we are at time. We can wrap it up. Thank you again for coming on and taking an hour of your day to talk about all this. And
Yeah, absolutely. No, and thank you for allowing the platform. This has been great. And within 48 hours, once I know our stand on affiliation agreements, you will be hearing from me officially for informatics rotation. So,
perfect. And
no,
then,
I appreciate what you have done and the document that you have put together to really try to identify virtual rotation preceptors. It's been very helpful. And that has been shared on AACP as well.
that's awesome. Yeah, so hopefully more and more people gets their hands and their eyes on that, and it will help out others. You are always welcome back, by the way.
Thank
If
you.
there's any updates and things like that, feel free to reach out. We have a couple of our other creators that do podcasts and write blogs and do a lot of things. So you're always welcome back. If there's any important things, we would love to amplify your voice as much as we can to spread the word. So,
Thank you.
but
And I will make sure that I have the camera working properly next time. So,
no worries, no worries. All right, we are good. So happy Tuesday, and Jen, really thank you again for coming on and sharing your experience.
absolutely. Thank you, Brian.
All right,
Talk later.
thank you.
Bye.
Bye.